Well, hello, please come in, take a seat, make yourself comfortable. Welcome to our ASMR clinic. I am Dr. Archie, be your ear doctor for today. Nice to meet you. Nice to meet you. So, I guess you have an appointment. Can you tell me your full name, please? Yes, I see. Today you'll have a detailed ear examination, ears, nose, and throat to be precise. Yes, but I guess you'd like to focus on your ears more than your nose and throat. Okay. Let me note it. So obviously, we're going to check your ears, clean them if it's necessary. We'll check your hearing, and after that, we'll check your nose, throat, and lymph nodes. Okay, this is a very standard procedure, so if you don't mind, let's get the examination started. I need to put my gloves on, but before that, may I ask you to make sure that the like button is pressed? Yes, please look down there. There is the like button. Yes. Can you press it? If you haven't pressed it already, this is very important for our ASMR clinic. Yes. Consider subscribing if you want. It is absolutely free. So may I ask you just to move a little bit closer to me? There we go. Yeah, so we start with your ear palpation. Yeah, in other words, I'll be touching your ears with my fingers. Yeah, usually it's a very pleasant procedure, sort of ear massage. Yeah, but if you feel anything unusual, you just let me know. Yeah, just tell me. Okay. So, firstly, I'm going to palpate your ears to see if there are any bumps, lumps, or anything like so. Then I'll check and palpate your ears one by one. Yes. So while I'm palpating your ears, could you tell me, have you got any problems with your hearing? Any ear blockage? Any strange noises, white noise? Some kind of humming? No? Good. So, how well can you hear me? Okay, we'll check it later. But now, we just need to make sure that there is no bumps, lumps, or anything that shouldn't be in your auricles. Okay. So far, so good. No bumps, no lumps. Just keep beating, and you just tell me if you feel anything unusual. Yes. As I said, this is a very pleasant procedure. Yes. Just like ear massage. So you just relax. Please keep sitting straight. Yes. This is very important. Do not lay down like so. I know this is very, very pleasant, but thank you very much. Thank you for your understanding. So, no sign of pain, no numbness, no. So far, far so good. Let's keep palpating your ears. And if I touch here, no sign of pain. Perfect. What about here? Good. Let me grab my flashlight. And there it is. Now I'm gonna be palpating your ears one by one. So it's basically the same touching. If you feel pain or discomfort, just let me know. Do not look at the light, it's kind of bright. And this is not a eye exam. Yeah, so we do need to follow the light today. But visit us next time and we can check your eyes as well. Why not? Let me see here. I'd like to make sure that your skin is okay, so no sign of infections, inflammations, no redness, and etc. Yeah. So when I'm pressing here, no pain. No pain, good, good. And what about now? Okay. So let's keep checking your left ear, your left auricle, yeah. Okay. And now your right ear. Again, if you feel anything unusual, just tell me. Okay. Yes. So when I'm pressing here, what actually do you feel? Good. And what now? So I suppose no pain. That's a good sign. Again, I'm looking for dry skin, inflammations, redness, infections, and I cannot spot them at all. As well, that's a good sign. Alright, just a little bit here. When I'm touching here, do you feel pain or anything unusual? No? Okay, good. So next up, the otoscope. So today I'd like to use the, let's say, digital, electronic, supersonic, the digital otoscope. There's a tiny camera there. Can you see me? Good. So I'll be checking your ear canals. Yes, and I can take a couple of photos if it's necessary. Yes, if you want to see your ear canals as well. So keep your head very still, do not move your head, okay? So I'll put it inside your ear canal. This is gonna be ticklish. But if you feel pain, you know what to do. Alright, let's start with your left ear. This is your left, okay. So let's see here. Okay, let's make it a little bit brighter, okay? Okay, and let's see closely. Alright. So, just a little bit of earwax, but I guess ear cleaning will be necessary for today. Yes. So, do you mind if we clean your ears today? You don't? Okay, good. Yeah, that'll be good. Alright, let me see just a little bit deeper. This ear blockage, just a little bit of earwax. And now we check your right ear. There we go. Let's see. Okay. Let's see here. Okay, I can turn this thing to the more convenient angle. Yes. Do not mind the clicking. Okay, so what do we see here again? A little bit of earwax, no blockage, but we definitely need to clean your ears today. It's not that actually too much. I mean, earwax, it's not that much, but we need to take it out beforehand, before we move on to your hearing tests. Yeah, otherwise we'll get incorrect results. Let's put it like so. Yes. So now I need to put it a little bit deeper. I'm sorry. Yes, that's it. And so, yeah, that's it. So, do you want to see me again? So, now we move on to your ear cleaning. Yes, need to turn this thing off, first of all. And now I'll grab a special tool. It is made for ear cleaning purposes. Yes, and it has a tiny lens to see your ears better. Yeah, and there is a light. So I'm gonna be cleaning your ears. I'm gonna be scratching, scooping, let's say it like so. Again, keep your head very, very still for me. Don't move your head. So this is going to be ticklish, but if you feel pain, it'll be kind of unpleasant from time to time. But if you feel pain, just let me know immediately. All right. Right. Let's start. So I'm going to start. So how are you feeling? Please do not move your head. I'm gonna be, holding your head just a little bit to prevent any movement. Okay, let's see through this little lens. Yeah. Okay, so this is going to be quick. Just need to scratch and scoop out every pieces of your earwax. Sorry if you hear any meowing on the background. This is our ASMR clinic cat. Yes. This guy doesn't want to stay quiet. Yeah. He just wants to see what we're doing here. Alright. I'm almost done with your left ear. As I said, this is gonna be quick. Alright, so how was that? No pain? Just a little bit ticklish. That's good. So now your right ear. So again, I'm gonna be holding your head just a little bit. So there is not much earwax in these ears, so this is gonna be quicker, even quicker. Yes. So just scratch, and scoop out. are you feeling? Okay, no nausea. Well, potentially, sometime you might have some nausea during your ear cleaning because of the inner ear theme, let's say it like so, yes. Alright, so you don't have it. Perfect, perfect. So let me know if you feel anything unusual. English is okay. This is just a part of this process. So that's it. Now your ears are clean, are absolutely clean, I would even say. And next up, a couple of hearing tests. Let's start with a tuning fork test. And here it is. So you do know what we're going to do now. Yes, so I'm going to be hitting the tuning fork, and all I want you to do, just tell me if you hear any sounds, any noises, any vibrations. So you do hear them. Perfect, perfect. What can you tell me about this side? Can you hear the sound? And what about this side? Perfect, perfect. Now I want you to cover your right ear with your palm, like so. Just press it tightly. Yes, just block it. Once again. Can you hear it with your covered ear? No? And now you can hear. So what about now? Just only with. Okay, okay. Now switch your ear. Thank you very much. Can you hear it with this ear which is closed? No? And with this one? You can with this one? No, only with your right ear. Perfect, perfect. Now open your ears. Can you hear it? Perfect, perfect. So, can you hear the meowing sounds? Okay, now can you make your finger like so, like a pistol? Yes, keep it like so. And I want you to point me, the direction of the sound source when I'm gonna be moving this tuning fork, but do not look at the tuning fork at all, okay? Can you hear it? And what's the direction? Okay, okay. See? That's not that hard. Just point me. Point and do not look at the tuning fork. Okay, I'm just kidding. That's it. Next up, a classical whispering test. I suppose this is your favorite test for hearing. Headphones. No, today we are not going to perform a headphones test because we performed it last month. Yeah. So, let's start the whispering test. How well can you hear me whispering after your ear cleaning? Better. So, see, that was the point of ear cleaning beside hygiene. Okay, so there will be 3 numbers for each side. I'll be very quiet, and I want you to memorize the numbers if you heard them correctly and repeat them back when I stop. Okay. Let's start with your right ear. So the numbers are 2, 5, 11, 2, 5, 11. What about your left side? How well can you hear me? Good. Okay. 1, 6, this time. What you say? Can you still hear me? Perfect, perfect. Alright. The numbers are 55, 65, 75. Perfect. So, what about this side? Can you still hear me well? Perfect, perfect. 14, 44, 88. 88. That's good, that's good. Okay, I'll try to be quieter this time, okay? Okay. So, I do not say anything. Yeah, I'm just kidding, I'm just kidding. So now, here are the numbers. 16, 60, 96. 96. Okay, okay. Okay, so let's try something like 35, 53, and 3. And 3, that's a good result. So for the last time for these sides, the numbers are 77, 17, and 67, and 67. Good, good. And for the last time, for this side, okay? So let's try like, I don't know, something like 8, 18, and 81. 18 and 81. That's a perfect result. So now let's try to perform a simple finger fluttering test, if you don't mind. Yes, you are here. I guess your hearing is absolutely fine, but to make sure that it is, let's perform the last test for today. Okay, I'm gonna be rubbing my fingers against your face. Again, make a pistol finger. Yes, and point me the direction of the sound source. Yes, 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 yes. May I ask you to close your eyes? Can you perform this test with your eyes closed? Yes, just close them. Alright. Yes. Yes. Correct. 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 And open your eyes. Everything is fine with your hearing and ears. And we move on to your nose and throat real quick. Okay, so I'll grab the otoscope again, which is nose scope, if there a word like so as well. May I ask you just to lift up your head just a little bit? I'm going to stick this little tip inside of your nose to check if there are any redness or anything unusual, any sign of inflammations. Yes, if you want to sneeze, please do not sneeze at my face, okay? Let me know if you want to sneeze badly. And now the other nostril. Okay, so Yes, I know, I'm sorry. But mhm, everything looks quite good. No redness, no sign of inflammations. Let's see this nostril again. Okay. Have your nose been broken? Okay, okay. So the nostrils are in a very good condition, no blockage. Nothing looks good to me. No redness, no dryness. Are you allergic to something? Like dust or anything like so? Okay, got it. And let's see where the last time. That's good. Everything is fine. Let's check your throat real quick. And for this, I'm gonna need this disposable stick and the flashlight. May I ask you to open your mouth as wide as you can? Going to place the stick inside of your mouth. Okay, and let's see your throat. I'm looking for any sign of redness, which is potentially might be the sign of inflammation, but everything looks good to me. A nice pink color, no redness, no bumps, which is good as well. Swallow if you need. Take your time. Now open your mouth again. And let's see. Can you say ah? Yes, a nice and long ah sound. That's it. And once again, can you say ah for me? Okay. That's it. Your throat looks good. No redness, no dryness. And in the end, let's check your lymph nodes real quick. I'm gonna be pressing, palpating, let's call it professional way, your lymph nodes here behind your ears. Usually it's absolutely painless, but if you feel, you know what to do. Yes, now your neck. Now underneath your chin, under the chin. Okay. Does it hurt? No? Okay. What actually can you feel? Just pressing, okay? And on your chest, so I need to put your top just a little bit down to palpate your chest lymph nodes. And back to your neck. Can you swallow? Big swallow. Again, does it hurt? Can you open your mouth and say ah again? That's it. And now again behind your ears. So everything looks good, no bumps, just the standard size of your lymph nodes. And this is it. Let's type down the results. While I'm typing, can you check the like button again? Is it still pressed? Make sure it is pressed. Thank you very much. Yes, consider subscribing, which is absolutely free, with the bell button. In that case, you'll get a notification every time we are online. Thank you very much. So, your ears are in a very good condition, no sign of infections, No inflammations, no dry skin. Everything is a-okay. Your hearing is very sharp. Yes, especially I suppose after the air cleaning. Okay, so your throat is clean, no sign of inflammations, no redness, as well as your nose. Yes, the nostrils are clean, no redness. And I suppose that's a very good sign, so you are very healthy. That's it for today's exam. Thank you very much. Sorry. Next exam, I suppose in a month. Yes. The headphones test instead of what? Instead of nose exam. Okay, if you say so. I'll make a note about it. And that's it. I got it. So, see you next month. Thank you very much for your visit. Goodbye. Take care.